Good evening. Thank you for being here.
Good evening. Thank you. And I shall remove my mask since I know at least 6 feet around from me. So first, I'd like to thank you first for in July when we had the mask mandate. Second, I would like to thank the gentleman who earlier discussed his concern about why we should not have masks moving forward. And then I do respect his opinion because I presume if I was in his situation, I would probably think the same way. I'm a physician now for 20, 30 years. I've been involved in the treatment of infectious disease in this community for a long time. And I recognize that infectious disease is not an easy story. It's a difficult story. And viruses are difficult to understand sometimes. They behave in unpredictable ways. And up to 4 or 5 in March, I look now, it's 7 months to over 210 days. I probably have worked almost 190 of those days. And I look back from the time the epidemic hit us and then spread. And I remember walking through the hospital with my mask on very early, and people were laughing at me and saying, "Why are you wearing a mask?" I said, "Because this is airborne spread. This is not contact spread as much as we would like it to be. This is not droplet spread as much as we would like it to be. This is going to be airborne spread." And then finally, yesterday, the director of CDC finally said it's an airborne spread. Finally, it took us 7 months for leading authorities to describe something that we suspected quite a while ago. And what do we do with airborne spread? What do? We wear a mask. We protect, we prevent, then we try to treat, and we strategize. The first initial thing of any infection, prevent spread, prevent transmission, prevent as much as we can until we have treatment strategies, until we have methods where we can stop the spread. And the first thing we have was the simplest thing and the cheapest thing is a mask. When we look at the cost of patient care we do every single day in the hospital, like today I saw with 5 or 6 patients, just got off the phone with the daughter of one of the patients, really, really sick, pending respiratory failure. And we've seen the data. We're still struggling. We've seen remdesivir, we've seen Decadron, we've used a lot of different treatment strategies. But when you look at the data from July to August to September, in July and August, we're completely overwhelmed. The first-line providers, myself, my infectious disease team, we're completely overwhelmed. We had over 100 patients in the hospitals, 100 to 150 patients in the hospitals. Then, thankfully, you decided to let's do the mask mandatory. And now what has happened in the last 4 to 6 weeks? This has dropped significantly. Right now in the hospital, I probably have about 20 patients compared to over 100 about 4 to 6 weeks ago. So when we're hearing the data, well, we're testing more. I said, let's look at data that's in the hospital. That's what I see every single day. You can be testing and testing, got these numbers, and we can call numbers. But here we are. We started intervention here in July. August, we saw this drop. Now where we are in October. And we are heading into the colder months. We're heading into the flu season. Not only is mask probably going to protect us against COVID, it's going to probably protect us against the flu season as well. So that's another story we need to add to this whole spread. I think St. Lucie County have done an amazing job compared to the other counties around, and I think that we will continue to do a really good job if we continue to supply and say mask is probably the cheapest way to treat COVID right now. And the director of the CDC said that it's almost as good as a vaccine. We are not close to a vaccine. We're several weeks away. We're several months away. We have better treatment options that we've noted. Midway, the organization I work for, we have several clinical trials we're doing in the community. We've been doing this for quite a while now. We started the remdesivir program in the hospital. We have the Regeneron cocktail that the president received. We've been using that as well in our outpatient facility. We've established treatment strategies. But I do think the counties itself, the population of this community have done an amazing, remarkable job in helping us, healthcare workers, by wearing masks and reducing the numbers. I think if we continue to do this through the Thanksgiving, through the Christmas holidays, we'll be looking really well heading into January, where we'll probably have vaccines and better treatment options. Thank you. Open for questions.
Thank you.
Go ahead.